Let's talk to Dr. Renee Hoenderkamp, who is, of course, NHS GP medical writer as well. Renee, very good morning to you.
Good morning, Mike. How are you?
I'm a bit annoyed, actually, as you can probably tell, because I'm fed up with this. Cobblers, it just goes on and on and on and on and on. And I know so many people who have done what they were asked to do, but who have now just said, look, enough is enough. I'm not doing the booster jab. I'm not interested. I don't believe you. I don't believe a word you say.
Yeah. So, I mean, it's just this constant mission creep, isn't it?
Yeah.
You know, we were told way back when that it was 15 million jabs to save our lives and get us back to normal. And then it just moved down and down and down and down. And now it just adds to that. And my problem with all of it is the coercion, actually. It's the constant coercion. It's very clear to us as doctors that no medical treatment should ever be given if somebody feels coerced to consent to it. And I can't see anything else that's happening here other than coercion. You know, have your booster jab or you won't be able to travel. To a 17-year-old, have your booster jab or you're going to miss out on the fun. You know, and here's a McDonald's thrown in to help you make the decision. And I'm really concerned about the coercion, because what we should be doing as healthcare practitioners is giving people the information and letting them make the decision over whether they want to take this medication or whether they're happy to take the risk.
I mean, you work within the medical fraternity, and I'm going to talk to Laura Dodsworth a bit about this later on. But what is it about doctors who want to keep kind of going against what you would otherwise have thought was the Hippocratic Oath, which is do no harm, you know, and I'm not suggesting for a minute that taking the booster will do harm, but it will harm some people and it will hurt some people, and some people will have a bad reaction to it. We know that because that's what's actually happened. But, you know, they're now talking about giving second doses to 16 to 18-year-olds. You were tweeting about that the other day. I saw a community newsletter from NHS Sussex at the weekend, which was saying to kids, effectively, if you want to come and get a vaccine, we won't necessarily have to tell your parents.
I mean, to me, that's horrifying, Mike, because, you know, when has the state ever stepped into parenting? Because that's exactly what it's doing.
Right.
You know, I am a parent of a big boy and a small little one, and what happens in their lives is down to me. And, you know, I'm the one who makes decisions for them. Well, not the big one now. I'd like to, but he won't let me. But the little one for sure. And, you know, the state getting involved is awful. And I really don't care about the people that will scream at me on Twitter about Gillick competency. We've used that for years. No, we haven't. You know, we do use Gillick competency in exceptional circumstances when a child is at risk if we don't treat them. And in my time as a doctor, I have treated one child under Gillick competency because she would have come to harm if I didn't. Now, that's not the case with these vaccines. We know that children very rarely come to harm if they have COVID. So actually giving them the vaccine is not preventing them from coming to major harm. And I just think this coercion is really sinister. And it really is sinister. I've seen so many children who are having the vaccine because their friends are having it. They feel the peer pressure and they believe the adverts that are on the radio and the TV and in leaflets all day long. Have this or you're going to miss out. That is appalling. Absolutely appalling.
And it really is in the background and in the backdrop, which we keep being told is going to be fixed. It's going to be caught up. We're going to be paying more taxes to catch up with all of the missing operations that have been done. Thousands of heart patients, we're told today, could die needlessly after being forced to wait up to 2 years for life-saving scans. 65,000 people delayed at least 6 weeks because COVID is still crippling the NHS. And there's no reason for it to be doing that, is there?
So I'm really concerned about all of this narrative because I think what they're doing is muddying the waters. We have a major problem in the NHS now because of the problem that we've got in the care sector. And I don't just mean care homes. I mean the carers that go to people's houses when they've been discharged from hospital and make sure they're okay. So we cannot get care packages for people. We cannot get care home places for people now because we forced out thousands of carers by telling them no jab, no job. And so then what happens is that those people who are absolutely ready to be discharged from hospital, they do not need medical care anymore, are sitting there and we can't admit people because of that blocking of beds, which is a terrible term, but it's happening. Why did we not use all of this money, this 37 billion, the Nightingale hospitals, to staff up these places with people who could actually just look after these people that need, you know, day-to-day help with their daily living, but don't need a doctor or a nurse, to free up the NHS, because then ambulances wouldn't be queuing outside, people wouldn't be waiting 5 hours for an ambulance, and so it goes on. But what we're doing as a government is we're blaming people for not having their vaccines and calling it COVID. And without a doubt, COVID has put a major strain on the NHS, But if we'd have sorted out these other problems, we would have been able to cope.
Yes, and an awful lot of the COVID strain that was put on the NHS was self-inflicted, because the NHS, in its own management, decided to do certain things which limited the availability of other areas of the NHS. I.e., they stopped people going to doctors' surgeries. They stopped people being able to see doctors. I've got countless examples, and I'm sure you have as well, of people who've been in touch with me to say, you know, I've now been diagnosed with stage 4 cancer. They said, oh, if only you could have come and seen us earlier. They went, well, we couldn't, because you weren't seeing anyone. And so people are now physically actually in danger. Many will die as a result of this ludicrous, you know, one-track-minded policy.
It is, and it's kind of a group thing, I think, amongst colleagues. They've been told that the vaccine is the saviour. Therefore, you can't think about anything else other than COVID and the vaccine being the saviour. Dr. Lucy Wilk wrote an excellent article yesterday in The Conservative Woman about this, and why doctors are staying silent and why they're accepting all of this when the data doesn't support it. You know, what is going on? And I think there's this absolute groupthink which makes you think, well, actually, it can't be. It has to be. This has to be the answer. Therefore, I mustn't say anything. I must be wrong. Let's go with this narrative. But we need people to stand up and start questioning this narrative and start thinking about patients who have other diseases.
Right, because every time I try and talk to any doctor who's in the NHS, apart from people like yourself who seem to be a little bit more enlightened, you know, they just kind of stare blankly at the screen and they've got these dead eyes, and they talk about how, you know, we must keep people safe and we must stop people from overwhelming the hospitals. And you go, well, a lot of people talk to me about going to hospitals and finding them relatively empty because they are still obsessed with COVID, and they're not really admitting people to large portions of the hospital because of social distancing, because they haven't had a COVID test. I heard from Cornwall, somebody let me know the other week, that in the ambulance cases down there, ambulance drivers turn up, the people sit in the ambulance for hours on end sometimes, they get taken into the very basic part of the A&E, then they get sent back out to the ambulance because they won't admit them. It's absolutely ridiculous.
I do think that A&E is under incredible pressure across the country, and there are lots of reasons for that, obviously. Lots of people are there because they can't actually get to see a GP face-to-face, or they're really struggling. I had a problem with my GP. It took me 2 weeks recently to get through on the phone.
Right.
And, you know, so that is happening, and GPs do have to sit up and say, look, guys, there's a problem. Let's come up with some solutions. Then there's the problem at the other end of the hospital with people who don't need to be there. So I think A&Es are under pressure, but you're absolutely right. We closed services across the board, services that didn't need to be closed. For example, you couldn't get your ear syringed in the NHS, but you could pay at Specsavers to do it. You know, so it was safe for Specsavers, but it wasn't safe for the NHS. And I could list you hundreds of things, but we need to get back to normal, and we need to find a way to free up capacity in the NHS, both at GP and in hospitals.
Right. And what is your sense as a doctor, Renee, in terms of why this booster is so much required? Because, you know, if we had been, for example, told back in, I don't know, the spring of this year, we'll give you two vaccinations, but they might run out come sort of the autumn, people would have been more prepared. But that wasn't being told to us in those days. That wasn't the case. The 2 vaccines were going to save us. You know, then it was 1 vaccine for kids. Now it's 2. They're now talking about trying to go all the way down to 5, like some countries are doing. I mean, there are other countries that are doing far worse things than we are, and I don't really understand the medical reasoning for any of it.
Well, I think your question in itself answers it, because this is my point about boosters. If they feel that antibodies are waning, if that's their measure, I don't know, because they're not really telling us, then what's the level, Mike? Tell us what the level is where they think that the vaccine doesn't work anymore. If there's a level, because they must know there's a level, otherwise why would they be offering us a booster? Then let's do an antibody test and let's see who actually really needs this booster and who doesn't.
Yeah.
And let's talk about T cells, which we never do. You know, let's have some information, but they're not giving any information. They're just coming on TV, telling people to have the booster, telling them they won't be able to go on holiday if they don't have the booster. So more, you know, arm twisting, but without giving any information as to how they have come to that conclusion. I am very, very dubious about the booster. I know that Dame Sarah Gilbert, who was one of the inventors of AstraZeneca, has said that we don't need to give boosters. We should send these vaccines to other countries where they need their first injection rather than a booster.
Yeah.
And yet here we go. I have respect for the JCVI, so I suspect that they are seeing information that has made them come to this conclusion. But can we have it, please? You know, we're grown-ups. Let us have the information. Let us have some antibody testing. I know what my antibodies are. They are sky high. I do not need a booster. You know, but let's arm people with that information and let's have a grown-up conversation for once.
Yeah, absolutely right. I mean, I was talking to a doctor the other day who was saying that, you know, the Pfizer booster, for example, is very good at dealing with COVID, but actually is not that great at affecting the rest of your immunity, and it might actually weaken the rest of your immunity to other things. Now, I haven't heard that discussed by the government. I also have never heard the government discussing how many people in this country have actually, as you say, got antibodies or have had the disease, because we keep being told there's all these positive cases all over the place. Well, why doesn't that make a difference? Why can we not say, well, if 90% of the population is vaccinated in terms of adults, then there's only 10% who haven't been. They might have already had it.
Well, I had a look at the latest variant report that was out this week. I think it came out Friday or yesterday. It's 77 pages. Every time they issue one of these reports, they change the way that they present the data. So they make it really hard to compare period on period. Right. But there is a paragraph in there that says that 98% of the UK population has antibodies, and that 18% of those are from natural infection. So, you know, can we talk about that then, please? Because if 98% of us have antibodies, why do we need a booster? Why do we need to keep coercing young people to have it when their risk from it is absolutely minuscule? You know, or is there a problem with the antibodies that are being generated by the vaccine, that they're actually not doing the job that they need to do? I don't know. And when you don't let people have information, then they start hypothesizing for themselves, and then they go down rabbit holes that they don't need to go down. We need transparency now. We need to treat people like grown-ups.
Yes, and we have to stop this ridiculous narrative that Boris Johnson sort of dug out of the grave yesterday about this wave of infection coming from Europe. Well, why is there a wave of infection coming from Europe? Is it because they locked down too long? Is it because they opened up too late? Is it because there is no way to stop these infections and you just have to get on with it? You know, there's any number of questions that nobody seems to want to answer.
No, I absolutely agree. And I think the answer is actually a combination of those things. They're having a wave in Europe because they have Delta. We've had Delta. We've had Delta. It's our dominant strain.
It's been around for months.
It's been around for months. I cannot see any logical reason from a scientific point of view why that wave in Europe should even make us look their way. I think it's sad, obviously, that people are still dying. But in the main, we have got to the point now where this is like a winter flu, and there doesn't seem to be flu around. So let's treat it that way, and let's stop terrifying people. We've done so much damage, Mike, by terrifying people. I've seen it this week. I've been in meetings this week with fellow colleagues who are terrified. They're on their booster, they're wearing their masks, they're sitting in the corner, they're terrified. And we need to stop this. We need to get back to reality and to life.
No, I mean, I go on the tube here in London and you see probably around about, I would say, a 50-50 representation of some people with masks, some people without. You know, if it was so dangerous, surely that would be a massive super spreader event every single day, every single hour, every single time you get on a train. There would be loads of cases. There would be hundreds of thousands of people getting infected. Many of them would die. But that ain't happening.
We also would see that coming from COP, wouldn't we?
Yeah. Well, they've had an earthquake up there. I don't know if that's anything to do with them. You know, we'll be talking about that a bit later on. But yeah, this is the thing, the hypocrisy of it all. And when you look around Austria and you look around what they're doing in Germany, what they're doing in Australia, New Zealand, you know, there's no pattern which really makes any difference, it seems to me. I mean, people always say, oh, well, the thing is they kept deaths to a minimum in Australia and New Zealand. Well, nobody goes there. You know, we had 10 million people flying into to Heathrow last year when we were supposed to be locking everything down. There were plenty of people coming in, and it's not about you know, how many people have died. We've got a much higher number of deaths than most other governments in other countries because of the way we measure them.
Yes. And I mean, and also, if you actually have a look at things like the World Obesity Report, COVID appears to be a map of obesity around the world, because with obesity goes all of the comorbidities, which means your outcomes for COVID will be much worse. It's not the only thing, of course it isn't, but it is a massive contributor. And we are seeing that across Western countries that have high levels of obesity. But we're not allowed to talk about that. And, you know, I will get flack for that after this interview for sure. But we need to be able to talk about that. We need to be able to, again, be honest. I spoke to my sister in Australia this morning, Mike. She is trapped in Australia and she actually lives there. And they've just mandated vaccinations for everybody who works in education. And yet, MPs in Australia are exempt from having the vaccine. If I was a teacher, that would say to me, well, hang on a minute, I'm being told I have to have this vaccine because it's so, so serious, but the MPs don't want to have it.
Right.
What are they not telling me?
Well, the same as Austria, where they're saying to people, well, you can't go out of the house unless it's for work or to buy groceries or to get medical care or to get yourself vaccinated, right? So they're not trying to stop you going out. They're just trying to punish you for not being vaccinated, because you can go out, and if you're actually in danger of spreading something, surely you shouldn't be able to go out at all.
Well, you'd think so, wouldn't you? I mean, the hypocrisy here is really weird. The messaging is really weird. And the longer it goes on and the longer they continue it, the more and more people are going to sit back and go, no, enough, I've had enough. And that's actually what should happen, frankly.
Yes, I think so. And I mean, do you think, or I mean, it's impossible to know what this government's going to do next. My sense is that Boris Johnson doesn't want to do anything more draconian than we currently have. When I'm out and about in London and other parts of the country, it looks as though things are relatively back to normal. I still see more people wearing masks than I would like to, but that's their affair. If they want to look stupid, it's up to them. But, you know, I can't see that the country will buy any kind of lockdown from Boris.
I'd like to think that. I really would, Mike. I really would like to think it. But I think a lot of people will buy it, but then they just won't follow it, because that's the other hypocrisy we have going on here. We have people who are gung-ho for restricting people's lives, but then they can bend the rules a little bit for themselves. And I would like to think that people are now going to say no. I think he has zero chance of cancelling people's Christmases. Yeah. I really do.
Yeah, well, he's certainly got zero chance of cancelling mine, because I'm supposed to be going to America. And if something bad happens and I can't go there, there will be hell to pay. Because, I mean, that's the other thing. They're all at it, right? I mean, I think last Christmas, did he not have, you know, somebody over to supposedly look after one of his children? And so they broke the rules effectively, even though Downing Street said they didn't. You know, we've got Matt Hancock with his hands all over his glamorous assistant. You know, I mean, it just goes on and on and on. And they can do whatever they want, and they expect us to do what we're told. Well, I'm sorry. That's the end of that story.
Well, it is, but from the very start of this, it really has riled me that anyone can tell me, when I can see my mother, who I can have in my house, who I can, you know, go to dinner with. You know, this is my life. Yeah. It's nobody else's. That doesn't make me selfish. You know, if I thought I had something that I was going to transmit to somebody, if I was unwell, if I had flu or if I had COVID, which I've had, as you know, I wouldn't go out. Right. Of course I wouldn't. I wouldn't go and see patients. When I had COVID, it was the only time, Mike, that I worked from home as a GP. Yeah. And I worked from my sofa, feeling pretty rubbish.
Yes, and that's fine, because you're a responsible individual, as most of us are. But get this, I'll end on this particular piece of madness, which we discovered this week. My local school says if your child has got a cold, they must attend school. Right? So it's all right for them to come into school and spread a cold, but if they've got any chance of running into somebody who might have tested positive for COVID, even though there's nothing wrong with them, they've got to stay home.
Well, this is the problem with targets for school attendance, isn't it?
Absolutely incredible. Ridiculous. Anyway, great to talk to you. Thank you very much indeed. Common sense.